All right. Good morning, everybody. Thank you for joining us today for this month's Solutions Spotlight focused on the Nurse Support Program. I am Cheryl George, your host for today, and I am joined by three expert presenters from the Blue Cross North Carolina team. We have Angela Lynn, Director of our Clinical Teams in Healthcare. We have Bradley Yelvington, Senior Program Manager in Healthcare. And we have Kate Ragsdale, Case Manager and Dietitian. We do have a couple of housekeeping items before we get started. This webinar is being recorded and will be provided to all of the registrants after the session. So if you are unable to make it or want to view it again, you'll have that opportunity. Feel free to utilize the chat and the Q&A features to ask questions. Either one is perfectly fine. We do have a team of experts behind the scenes that are helping answer any questions that may pop up, and we will leave some time at the end as well. And lastly, at the end of today's session, a post-webinar survey will automatically be sent out, and your feedback on that survey is very important to us. It helps us create more dynamic and engaging webinars for the future on topics that you care about. Plus, by completing the survey, you will be automatically entered to win a drawing for a $25 Amazon gift card. So please be sure to keep a lookout for that. And with that, I'm going to jump into our webinar, or into our agenda, excuse me. As you can see, we have a full agenda today. We're going to start off with the question that, if you don't already know, I'm sure is on top of your mind today. What is the Nurse Support Program? And then we'll run through some details related to AI, or artificial intelligence, and its role in transforming care, including a personal testimony that we're excited to share with you all. We'll touch on mobile member support featuring the WellFrame app and how it works with member engagement. And lastly, we'll run through some promotional and engagement support that we have available for you and wrap up with any questions. And to kick things off, we are going to start off with a poll question today. I'll go ahead and launch that in the chat. And that question is, according to a 2018 study done by the Agency for Healthcare Research and Quality, what is the average 30-day all-cause adult hospital readmission rate? So we'll give you all just a second to answer that one. And I do see a lot of questions pouring in, or a lot of answers pouring in. Thank you. And it looks like almost everybody's getting it correct. It is B14, and that's just within 30 days. The answer is 14% with an average readmission cost of $15,200, just within 30 days. So you can see how readmission, besides being burdensome and sometimes very scary, can also be pretty common and costly. So we'll talk a little bit about that today. With that, I'm going to turn it over with our first presenter, Angela Lynn. Angela, take it away.
All right, thank you, Cheryl. So I'm really happy to share that now we are managing all of our members' care needs in-house through our nurse support program. And so that means whether a member is dealing with a complex acute situation, or if they have a chronic condition with ongoing needs, that member can receive the support they need in one place, with their healthcare needs being managed by one of our nurse advocates, backed by a multidisciplinary team. Both our case management and our condition care staff have enhanced capabilities that allow them to identify, manage, and communicate with members in need. Our nurse support program is optimized for members because we have deeper relationships with our providers, and we have immediate access to claims and other data that help us to identify them more timely. Our nurse support program allows us to expand our clinical reach and actually be more responsive to our members' needs. And this is important because research has shown that there is a sense of urgency when it comes to making outreach to members. And so if you don't make that outreach timely, the opportunity to engage that member is lost. And so our nurse support program is powered by data and insights and technology, but none of that would be valuable without the compassionate and empathetic human connection that our health advocacy team provides. That is why we deploy a full multidisciplinary integrated team of experts that include certified diabetes educators, pharmacists, behavioral health specialists. We have social workers, registered dietitians, and also support staff that are helping our members. So we start our outreach process via phone call. So there's primarily two different pathways, two main communication pathways that we leverage. So if the first the member is contacted by phone, and then if we're unable to reach the member by phone, we will mail an invitation letter to the member, inviting them to call us back for information. If the member still doesn't engage at that point, we will continue our outreach to engage for 30 days. And that includes calling the member 2 additional times. And then we also follow up with a final letter and a brochure to try to engage the member. If after that 30-day period, we haven't engaged a member, the member will not be identified again for 90 days. Unless they've had some kind of significant event like being admitted to the hospital. Also, if the member has a registered email in our systems, the nurse can email the member as well and use that as a method to engage. That's why we feel that it's essential for groups to promote Blue Connect registration, and for members to update their contact preferences within Blue Connect. We will discuss some other helpful resources around engagement later in the webinar. But I did want to say that members can also self-refer into our program by calling the nurse support phone number, and then third-party individuals such as on-site nurses from on-site clinics or HR directors can also make referrals into our program as well. So we don't just rely on our own internal systems. We do have the ability to take resources from other places. So the nurse is our initial contact with the member. That nurse will assess the member's needs, look for issues and any questions to kind of determine if any other specialists are needed to be brought in on the team. So if the member has questions about medications, then they may bring in the pharmacist to reach out to the member, and the pharmacist may even call the member's provider to get additional information. If the member is struggling like with depression or anxiety, we will refer either the social worker or behavioral health specialist and bring them as part of the team. And then if the member is wanting to work on a healthy diet, or if they have other nutritional needs, then we may bring the registered dietitian in to work with that member. So the entire team has access to the WellFrame app, and that allows the care team to monitor the member's progress. It ensures that we have coordination and consistency, and it really provides for an integrated experience for the members, so that all team members kind of know what's going on with that member. To provide a little additional detail about our case management program, case management is really for members that are dealing with the complex health issues such as cancer, stroke, or other catastrophic injuries. And what our team will work to do is to help that member understand their condition, their treatments, and what their provider's plan is for them. We're going to help them with resources to help make informed healthcare decisions. We will guide the members in methods that help to improve their condition day to day. So how do they self-manage their condition on a daily basis? We connect the member with internal and community resources, make sure that they understand their benefits and are using them effectively. And then we help provide care coordination between all of their providers. For our condition care program, that's the same kind of, we connect the member with their primary care provider. We're making sure that they're going to quality network providers. Outreach could happen from the registered nurse, the clinical dietitian, the pharmacist, or the social worker. We're going to provide additional behavioral health support and referrals as needed. Members get onboarded to our WellFrame clinical app, and then they assign care modules based on what the members' learning needs are. They address any barriers to care, connect the member with community resources. They perform medication reconciliations and therapeutic optimization. And then really try to steer the member to any kind of point solutions that will help promote therapeutic lifestyle modification and aid in the management, reversal, or kind of slow the progression of the disease. In addition, they'll address any barriers to optimal care, and those barriers might include like social drivers of health, and also ensuring that we have health equity and trying to promote that. Okay. By reaching the right members at the right time, we are using our innovative care path predictive modeling. We're not only trying to drive engagement, but we are ensuring that the care team is being optimized to provide information to the members so that they get the support they need when they need it. CarePath accurately identifies people who are at risk of complication or that have maybe preventable readmissions. So that's what it's designed for. So this slide here, we're looking at comparing our CarePath AI model to the industry benchmark, the LACE model. And LACE stands for length of stay, acuity of admission, comorbidities, and emergency department visits. So that's all looked at to kind of give the member a risk score. And we found that our CarePath model was 2 times better than the LACE model at predicting 30-day readmissions, and it lowered costs by 50%. So this really allows our nurses to focus on the right members at the right time and making sure that we're providing that right intervention and that we can help flatten the cost curve and promote and improve the members' health outcomes. So by reaching the members at the right time, using the innovative CarePath predictive modeling, we are not only driving engagement, but we are ensuring that our team is being optimized to provide the members the support they need. CarePath is kind of what we call innovation in action. It infuses data from like social vulnerability indexes, as well as other socioeconomic variables that, and then combines that with our analysis of claims data, daily authorizations, and risk scores. It supports real-time, nimble, iterative predictive modeling. And then it kind of supercharges our nurses' ability to tailor their outreach to reach the right members. And the right members would be those that are at high risk or rising risk for like intervenable opportunities such as ER or inpatient stays. And we have noticed some improved outcomes in multiple areas that help to drive nurse engagement and savings. And these have included, we've seen increased engagement, we've seen decrease in inappropriate ER utilization, decrease in preventable readmissions. We've helped to reduce the impact of social drivers of health that, kind of affect the members' ability to meet their goals. And that's things like addressing food insecurity. We're looking at any kind of transportation issues. If there's food insecurity, we're trying to address those and kind of close those gaps. And then we've also seen like decreases in 30-day readmission, and we've had increased PCP engagement for our high risk members. So this really allows our nurses to support your employees and their families, to be proactive and to avoid those preventable hospitalizations. We're trying to prevent the readmissions to the inpatient setting. And we are really trying to prevent or reverse conditions for those with rising risk to ultimately flatten cost curves, because that's where the savings really comes in. So we've gotten some results like from our hospital to home program. And so our findings show that our CarePath model, predictive modeling, has led to a 71% increase in engagement rates. And then also we've had some implied savings from our commercial hospital to home program. We've seen about $829 per member per PMPM per engaged member. And that equates to about $9,948 per member annually. And then when it comes to the reduction in readmissions, we've seen a 39% reduction at 30 days. We've seen a 64% reduction at 60 days and a 68% reduction in readmissions at 90 days post-hospitalization. So we are really proud of the results that we've seen so far. So with the addition of our care path, again, we've seen some improved outcomes in multiple areas to help drive savings. So again, those outcomes that we've seen include increased engagement with our nurses. We've seen our engagement rates go up. We've had decreased inappropriate ER utilization for members that are in the program. We've seen decreased preventable admissions. We've reduced the impact of social drivers of health that impact the members' ability to meet their goals. And we've seen decreased in 30-day readmission and increased PCP engagement for our high-risk members. And that PCP engagement is really important because we want the members to follow up with their physicians and receive appropriate care from their physicians, because that is shown to decrease hospitalizations as well when people are appropriately managed in the outpatient setting. So our data allows us to quickly identify members with intervenable risk so that our care management team can engage these members in their health while also managing costs. So this slide kind of indicates that we use a plethora of data to really understand the level of risk that a member has. So really, to understand the member's whole health, we have to look at other variables alongside claims data, authorizations, and risk scores. And that is where our care path model is so helpful in that area, because it really pulls in other measures that we can look at to really identify risk. So our award-winning care path AI model, it was developed by data scientists in our innovation garage. So it was developed right internally at Blue Cross. Care path includes social vulnerability index. So it looks at things like the socioeconomic status of the member. What is their household composition? What is their minority status? It looks at race and ethnicity. It looks at their English language proficiency. And then it includes other socioeconomic data that we know plays a major role in health. And it really helps us to identify the impactable members. And our nurses are armed with that information so that they can, really provide the right intervention to these members. Our technology helps us to identify members who are at rising risk. So not just those that have, high cost conditions or that are already complex. We want to get the members before they become complex, and that those that are at increased risk for poor outcomes, members that are poorly managed. And then care path will task those members to our clinical team for nearly real-time intervention. And this team of our nurse care managers, our dietitians, our social workers, behavioral health specialists, and our clinical pharmacists are all going to work together to support that member in what they need. So really, by marrying our data approach with caring, compassionate professionals, we're able to predict risks. We can tailor our care plans to really meet the members with what they need, and we can tailor our outreach to the members sooner so that we're able to have a more measurable impact. So I'll talk a little bit about our models in our program. The first program that I'd like to talk about is our hospital to home program. And the hospital to home program, we call it H2H. It provides for outreach to members who are transitioning from the inpatient setting to home. And that's those that have been identified as high risk for readmit. And so our focus intervention, it engages the members at the time of admission. This is much sooner than what we have seen in traditional transition of care models that tend to reach out to the member post-discharge for outreach. We find that engaging the member while they're in the hospital allows our nurses to provide support and education to the members while they're inpatient and while they're still in the hospital. And this interaction empowers the member to fully engage with their treatment and discharge planning, and it ensures that they have a more successful recovery at home. So the evidence-based interventions that are included in our hospital to home program includes member engagement at the time of admission. We have education and empowerment throughout the discharge process. We review and have teach back of their discharge instructions to make sure that the member understands what they need to do at home. We are going to perform that medication reconciliation because we know that, sometimes when the members go inpatient, their medications are changed. We want to make sure there's not any duplicate medications that the members on. And that's really where our clinical pharmacist comes in so handy to really help with that med rec piece of our process. We make sure that the members are following up with their primary care physician within 7 days after discharge. We help with home health and doable medical equipment coordination, if that's something that the member has ordered. And then we just really help with coordination of additional supports that the member may need. Perhaps that might be a referral to behavioral health, making sure that that's taken care of as well. And then our complex case management program, or we call it CCM program, that is our NCQA, and that's the National Committee for Quality Assurance certified program in population health management standards. So our CCM program is an innovative, evidence-based model that's specifically designed to improve member health outcomes for our most complex members. So using this process, with our CarePath model, we've designed two different models for complex case management. The first AI model outperforms our traditional segmentation models in identifying complex members that are at risk for 30-day readmissions. And then our second model that we have accurately predicts risk of inpatient admission for members that have had an ED visit in the past 30 days that did not result in an inpatient stay. So it's really looking at those members to say, okay, they've had an ED visit. How can we intervene to make sure that we are taking the appropriate action and steps so that they're not needing to go into that inpatient setting? And then our next program that we have is our condition care program. And this is an innovative evidence-based model specifically designed to improve health outcomes for members that have specific chronic conditions. And we designed our model to kind of expand beyond the traditional big 5 conditions. So normally, most disease management programs, they're going to have, diabetes, asthma, chronic obstructive pulmonary disease, congestive heart failure, and coronary artery disease is kind of the main parts of their program. But we focused our intervention to engage members who are identified as rising risk of developing high-cost conditions. So we're intervening much sooner than traditional disease management programs. We're able to engage members earlier, and it allows our nurses to provide interaction so that we can really empower the members to fully engage with their providers, to get involved with their treatment plan, and hopefully prevent progression of that disease state, because that's our ultimate goal. The condition care program provides outreach to members identified as rising risk of specific outlined conditions. And so those conditions that are included in our model include diabetes, atherosclerotic cardiovascular diseases. We look at early onset chronic kidney disease. So that's chronic kidney disease in stages 1, 2, 3. So really identifying them earlier. if they have respiratory conditions, and then we also have a model that predicts high risk maternity. The program offers preventable quality indicators. So we're also looking for any kind of identify any preventable admissions and any other impactable admissions related to diabetes, heart failure, constructive pulmonary disease, hypertension, asthma, and also community acquired pneumonia. So that's just a little bit about our program. So now I'd like to transition and introduce Kate Ragsdale. Kate is a dietitian on our care management team. She has worked in healthcare as a dietitian for nearly 10 years. She has experience in ICU nutrition support as well as outpatient care. And she specifically specializes in dietary management of GI diseases. So she's here to share kind of a personal testimony of how CarePath technology has helped with the outreach and identification of a member that she's worked with. So Kate, I'll turn it over to you.
Thank you so much, Angela. And hello, good morning, everybody. It is a pleasure of mine to be able to share a little bit of a story right now that I had some experience with. So just like Angela was sharing, this member was identified in a hospital to home survey and was identified by one of our nurse case managers. She triggered as a need for nutrition counseling, which is how I became on board for this member's management for her care. And to give you a little bit of a background, this member had been through 6 months of an ulcerative colitis flare. And if you're not familiar with that is, that is a lower GI or gastrointestinal disease that can affect the bowels and can affect the function of the gastrointestinal system. And after having gone through 6 months of this, she ultimately ended up in the hospital. And at the end of, part of her care at the hospital, she required ileostomy placement. And again, if you're not familiar with that, an ileostomy is essentially a pouch or a bag that's placed to help divert the excretion of the bowels so that that area that normally it runs through can evacuate, and that area can actually heal better. So we're just diverting it to a different setting. But before this surgery had been done, this member, like I said, had gone through the 6-month battle, and that led her to meet malnutrition criteria. She had lost 60 pounds. Her skin was in very poor condition. She lost a ton of muscle mass. She lost a ton of subcutaneous fat, and she had no energy. On top of that, her hair was falling out. She really struggled to get comfortable with this new ileostomy. It's not normal. None of us really are comfortable with having a new way to evacuate our bowels, essentially. So after her hospitalization, when she came home, she really wasn't driving. She was sedentary. She was bedbound just because she had no energy. And she really felt like she was at a loss for how to care for this new ileostomy and replenish her nutritive stores. She said if she did meet with a dietitian, she didn't remember it because it was kind of such a haze of a hospitalization, and she couldn't teach back any principles that she learned. And while my job could have been, and sometimes is, to refer out to an in-network dietitian, it was very clear to me that her motivation was low, and she might not be likely to attend visits in person. So I recognized that it would be best to meet her where she's at in the comfort of her own home with calls. As somebody who specialized in high acuity nutrition support cases. So given my experience, I really was happy to help assist her. And in our time together, we were able to develop somewhat of a plan to help get her baseline nutrition needs back to a foundational level that she could function well. She wanted to be able to roll on the ground with her grandchildren and be able to go up the stairs and carry in groceries and really be able to drive herself to appointments too. So we worked on identifying some high calorie foods that she could eat, starting a multivitamin regimen and making sure that her, like I said, her nutrient stores were back to an appropriate baseline. And most importantly to me was to make sure that I could help educate her on how to prevent the number one reason for readmission after new ileostomy placement. So I really was doing a lot of educating on her on preventing dehydration. And given this, she was able to avoid readmission. Now, our work together was not just it was not the easiest journey. We worked together but for about 5 or 6 months, and of course life happens. There were a few setbacks. She got the flu, she got COVID, but throughout the time we kept working together. Her motivation continued to increase, and I felt very encouraged by her work. And she gained nearly 10 to 15 pounds. She started working and actually graduated from physical therapy. And she said to me on one of the calls, "Kate, you won't believe it. I had to get my hair cut twice since we last talked because it's growing in so well." And I was, you just have to chuckle because some of these things are really important and make a lot in the difference of the member's confidence and the agency to care for herself. And that's one of the things we want to do is give agency back to the member, give them the autonomy to care for themselves the best way that we can. So she felt more confident in the ability to care for herself, manage her ileostomy, and continue to gain strength. So I felt like she did an excellent job in the 5 to 6 months we worked together, and I was able to sign off and really felt like this was important to be able to, like I said, give her that agency to provide herself and care for herself the best way possible. And I felt like that was definitely done by the end of our time working together. So that is just one of the ways I work with members. So this member I worked with telephonically, and some of the ways I'll work with members and other team members will be through digital platforms. So again, while this member was a telephonic engagement, my next colleague, Bradley, is here to tell you about another great offering that we have, which is to connect our members through a digital health platform. So I am going to hand this over to my colleague, Bradley, and she can take it from there.
Oh, Bradley, I'm sorry. I think you're on mute.
Sorry about that. Good morning, everybody. Thank you, Kate, so much for sharing that amazing, moving story that you had, and glad to be here to talk a little bit about WellFrame. So I am going to spend the next few minutes walking you through the member experience with our digital care management app called WellFrame. Both Angela and Kate have mentioned this earlier, but first I think we have another poll question. All right. According to a Deloitte Healthcare Consumer Survey, what are some of the important benefits that digital healthcare tools have in the future of care? So I'll give folks a few seconds to answer the question. And Cheryl, just let me know when.
I think it looks like everybody's getting the correct answer.
Oh, awesome. Answer D, all of the above. Each of these results are achieved through an increase in member engagement and access literally at your fingertips in your back pocket, increases the chances of that engagement. So with that lead in, we're going to talk about how Blue Cross is using digital tools to enhance member experience, to increase engagement, and connect and educate our members. So WellFrame is a digital care management app that delivers care programs to members at their fingertips. It monitors their progress in real time and provides clinical alerts for the care managers and specialists based on the member's input, and enables an easy and convenient two-way communication. On the left side of the screen, the screenshot is the member's mobile experience. We'll be going into a little bit more detail on that in a few minutes. And on the right is the snapshot of the care team's dashboard. This is what our care management team uses and how they manage the member, how they securely message the member, how they track the progress, receive alerts, and can view any surveys that the member has filled out. So most members onboard to WellFrame after speaking to a nurse. So the nurse invites most of our members into WellFrame. However, last year we launched a few campaigns that encourage members to self-onboard onto the WellFrame app. And so once onboarded, members have access to the same level of support with our digital care management team, as well as all of the specialists that have been mentioned before, the dietitians, the pharmacists. We're going to be expanding these self-onboarding opportunities this year, which we'll talk about in a little bit. And the last thing I'll mention on this slide is that WellFrame does require a smartphone or a tablet. So once a member onboards to WellFrame, the care team assigns care programs based on that individual member's needs. So these care programs are designed to educate the members and gather data directly from the member via short surveys throughout the programs. These programs are holistic in nature and can address specific conditions like some of those that are listed here, medication adherence, biometric tracking like weight, blood pressure, blood sugar. Programs are available that address lifestyle goals, smoking, stress management, or weight loss. And the short surveys assess members' progress and alerts the care team to any concerns and allows the care team to monitor the members throughout the length of the program. All of the content is from nationally recognized reputable organizations that are such as those that are listed here. And in addition, WellFrame has ensured that the content is written in plain language, with most content written in a fourth grade reading level to address health literacy. The easy to read multimedia format and accessibility features also allow for diverse learning styles. So all the members of the care team can securely message with the member via the chat feature. And members are notified when they have a new message. Members can also reach out directly to their care team. So it's two-way communication. Members can reach out to the care team or vice versa. So these messages are viewable by the entire care team, including any of the specialists like the dietitian with whom the member is working. If a phone call is necessary, it can be arranged via the messaging app, in which will cut down on phone tag. The health checklist is provided to the members every day. So they have a customized content that will appear on their daily checklist. These checklists are designed to be really short and convenient and not overwhelming. And completing their daily checklists help our care team better support that member. You can see a list of the types of tasks that a member may see. Again, their daily medication reminder. Bradley, don't forget to take your 8 a.m. meds. Articles associated with the care programs that they are enrolled in about managing their diabetes, educational videos as well, and then any physical activity goals they might be trying to achieve. The reminders section includes features such as medication reminders and general health reminders like going to a doctor's appointment. These reminders can be set either by the member or by a person on the care team and can be set up on a one-time basis or on an ongoing basis. The reminders would show up on a member's daily checklist, such as reminding members to take their morning meds, or don't forget, did you have your doctor's appointment at 2 o'clock today? And on the Me tab, members can track their progress on the WellFrame program, including task completion, steps walked, medications taken, days they've been enrolled in the program, those types of things. The care team can also leave members instructions or resources the member may want to consult periodically. This allows the member to easily access content that the care team has provided without having to scroll through a bunch of messages in their secure message section. And then finally, an extensive library of educational articles is available for the members to search and browse. And as I mentioned before, relevant articles are pushed to a member's app based on the care programs in which they're enrolled. and articles, again, are included in their daily checklists if applicable. They can save articles to their favorites if they ever want to view them at a later time. Next, we're going to start talking a little bit about how to promote the nurse support program and increase engagement. So here we have some ideas and some thoughts on how to promote the programs to increase engagement in the programs. So both case management and condition care are rewardable activities. ASO groups have 3 potential options to reward members that are listed here. And for all fully insured and balance funded groups, for the fully insured base program is automatically included. And for fully insured balance funded groups, 100 plus, they have the option to purchase the fully insured enhanced wellness offering, which offers a higher incentive for engagement. Just contact your sales rep to learn more about these options and how to sign up for them. We've got employer promotional materials available to you in your respective portals, the agent portals and the employer portals. We have flyers, brochures, email templates available for you to send to your employees directly, like through an intranet or email directly to them. And again, these materials are available on the portal. For some ASO groups, we've deployed a Take the Call campaign, like the one that is pictured here, which educates the member on what the nurse support program can do for them and encourages them to answer the phone if a Blue Cross nurse is calling. And I mentioned earlier that we have targeted WellFrame campaigns. So we have begun sending targeted WellFrame campaigns, encouraging members to onboard WellFrame to get started with the program. Once onboarded, they'll again have access to all that WellFrame has to offer and will be connected to our digital team that includes a nurse and an engagement specialist or a support staff. And again, if needed, members will have access to the wide range of specialists, dietitians, diabetes educators, pharmacists. We're currently in the middle of sending a weight management WellFrame campaign, and we'll be rolling out this by segment over the next maybe 7 to 8 months. We're identifying members who are obese as our identification criteria. So we're currently in the middle of sending it out to the individual segment. And in the fall, we'll be starting with the fully insured group segment. And then in the late fall and into the winter, we'll be sending to ASO groups. So as I mentioned, we've started it with individual. We've had about 90 members self-onboard to the WellFrame app and enroll in the weight management program. So we're excited about that. We also have an onboarding and plan management campaign designed to help employees understand the benefits of their health plan on an ongoing basis. The plan management campaign features the nurse support program in month 6 email. That email theme is enhance your health and well-being. So more information on this plan management campaign can be found on your respective portals. And for ASO groups 250 plus, they can consider adding additional programs to engage members to onboard into the nurse support program, such as Signature Service and Engage Health. So Signature Service is a customer advocacy support program staffed by a team of customer solution experts. This dedicated team helps to answer any questions members might have about their benefits and to provide guidance throughout their healthcare journey. They can recommend and refer members who feel they're appropriate to the nurse support program and other programs like that, and can transfer that member to the nurse support program staff. We'll be sharing our Signature Service Brain Shark as part of the webinar follow-up. And I believe Cheryl is going to actually put the external link in the chat as well. And Engage Health is a high-touch nurse support program with Signature Service and a dedicated team. You must have 500 ASO subscribers to qualify for Engage Health. And what makes this offer unique is that it's a personalized, holistic health advocacy program that drives better health outcomes while lowering the total cost of care. The clinical staff to member ratio is lower to increase engagement, minimize handoffs, and generate personalized care. We'll also share the Engage Health member experience video and post it in the chat for those who want to pull that up now. All right. And we wanted to also share the resources available, for our members. So we mentioned the extensive library of materials related to the WellFrame available in that app, and so we wanted to mention that again. We have marketing materials available on our employer and agent portals, including condition care flyers, care management flyers and brochures, and a WellFrame flyer. Some of those are shown here. We've got an email template here as well, the case management brochure that goes out to our members that Angela mentioned, and then a new WellFrame flyer that has a self-onboarding code on it. And again, all of these are on your portals. We have a nurse support program, BrainShark, that I think Cheryl's going to put in the chat, and that's about a 4 or 5 minute video that you and your employees can take a look at. It reiterates a lot of what we covered here, provides the phone number if somebody wants to share, to call in directly to the nurse support program, as Angela mentioned earlier. And we have a behavioral health BrainShark as well. Cheryl will link that in the chat. It highlights some of the work our nurse advocates can do in helping members find the right care at the right time. And I do want to note that many of these resources are available in English and Spanish. So again, just wanted to give you a list of the resources for a holistic view of how our nurse support program works and how it's integrated with everything we do here at Blue. And then I wanted to wrap up our formal presentation and share and build on what Kate shared with her really moving member testimonial and provide you a few direct quotes from our members. I won't read all of these out to you, but you can see for yourself the impact that these programs and that our staff is having on our members' lives. We'll leave these up for you to read so that we can check and see if any questions have popped up that we need to address. And I think Angela, might come back on video and we can address any questions.
Thanks, Bradley, for that. So a couple of things. There was one question in the Q&A box about where these links were available, and they are available in the chat. I know it's a little bit confusing. Some people have a preference of one versus the other, so we allow both. So if you're missing those links, you can find those in the webinar chat. It does look like we are having an issue with the Engage Health member video that was on YouTube. It's asking for a passcode. That's unusual. It's not a problem I've run into before, but I will follow up in the follow-up email that we'll be sending out after the webinar. I apologize for that. That should not be happening. So sorry for that inconvenience, but we'll hopefully get that figured out. Okay, so one question that did pop out throughout, it was essentially how does a member we touch on Blue Connect, and the question was essentially, how does a member register for Blue Connect? And then secondly, how did they select their contact preferences? We have one for that.
So I'll take that one, Angela. So if members just go to bluecrossnc.com and you click the member login, and you can create an account there. And then once you've logged in and on the home page, there's a left navigation and there's a profile link. And within that profile link is there are 3 tabs, and one is contact preferences. And so if they click on that contact preferences, that's when they can select there are several different options that they can select based on what the content is of the of the material that we send you. There's some things that we're required to send you, but there are also other options for email and direct mail. We are trying to encourage members to go paperless, and again, the more Blue Connect accounts and emails that we have, the more options that we have to connect with members in the way they want to be reached. So we really encourage members to create Blue Connect accounts, to select the contact channels that they prefer so that we reach them in the way that they want to be reached.
Awesome. Thank you for that. We do have another question and that is, what is the phone number for the nurse support program that a member may use? I'm wondering if you happen to know that off the top of your head, but if not, we could pull that and type that into the chat behind the scenes really quick.
Angela, do you know that off the top of your head?
I do not, but I'll find it and pop it in there.
Okay, wonderful. Thank you. And then we want to talk a little bit more about engagement. So I think, Bradley, you mentioned a lot about engagement, but I think, Angela, that was something that you touched on briefly closer towards the beginning of it. And just wondering if we could talk a little bit more about the outreach that you mentioned, the calls, the emails, the letters that members can receive from Nurse Support Program. Can you sort of reiterate that, I guess, for folks who may have missed it?
Yes, I'm happy to. So our first outreach attempt to a member is going to happen by phone. So we're going to try to reach the member by phone. And if we're unsuccessful at reaching them by phone, then we send a letter. It's kind of like an invitation letter, inviting the member to call us back so that we can provide additional details about the program. If they do not respond to those first two attempts, we will continue outreach for like a 30-day period. And that will include 2 additional calls to the member, as well as a final letter to the member. And we'll also send a brochure kind of explaining what the program is about. And all of that includes our contact information so that they can, call us back if they ever need us in the future.
Sure, absolutely.
Yep. And then also that's where the part about, the email comes in. So if we have access to their email address, we will also try to email them as an opportunity to try to engage them in the program as well.
Wonderful. And we do have a question about concerning all of this outreach. Is there a way that you recommend that employers sort of notify or give their members a heads up about what this outreach is going to look like ahead of time? Maybe it's through some of those promotions that you mentioned, so that employees don't sort of screen calls or just think they're getting another spam. I don't know if you're like me, I get tons of spam calls, particularly when I just moved, so I get a bunch. Maybe that's something that the promotions we touched on could speak to.
Bradley, you want me to take that one?
If you don't mind, that'd be great.
Yeah,
Angela.
sure. I really think that, leveraging some of the resources that Bradley mentioned, whether that's a flyer that we provide them or brochures that they can hand out, or even us, helping to craft, if they have a newsletter that they share with their employees, or an intranet that they, reach out to their employees on. Anything that kind of increases awareness of the program actually helps. And so that way the member is not totally surprised when they hear from their insurance company. And we have tried to include in the scripting of our nurses that, that we are, we try to mention the employer group's name that we're working with, and that we're partnering with the employer group to provide these services. And that sometimes helps to connect the dots for members, try to tie that into their benefit plan.
And the Brain Shark that we linked earlier, please remind me, that is member facing, correct? So that is another thing that employers can share with their members.
Yes, it is.
Absolutely. Yeah, absolutely.
Awesome.
The Nurse Support Program Brain Shark is member facing for sure.
And that is in the chat, and we'll provide it again in the follow-up email, of course.
Right. We modified that recently to add the well-framed self-onboarding code within the Brain Shark. And phone number is on the last slide. So again, a number of ways that we're giving members to enroll and engage in the program.
Awesome. And then going back to an earlier question, we had the Nurse Support Program phone number. We were able to find that, and that is in both the Q&A answered questions and the webinar chat as well. So if that was something you're curious about, you can find that. We do have another question. Is an employer able to ask for a nurse advocate in certain cases? We may not need it for all employees, but is a good option in some cases. So is that something that like an employer is able to do, or is it a direct to member outreach?
No, we have had employee groups that actually, whether they are connecting with their sales rep and sending in inquiries that way or reaching out directly. We're happy to take any information and make outreach to the member to see if we can provide assistance. Yep.
Okay, awesome. It looks like that might be it for questions for us at the moment. If there's any that come or pop up after something that comes to mind at the end of this, please feel free to shoot us an email or respond to the follow-up email, and we can try to get that answered for you. I want to thank our lovely presenters once again today, and for everybody for joining us on the call. If you joined later, had to jump a little bit early, just a reminder that this webinar is being recorded, and we'll provide that in the follow-up email. Also, please be sure to complete the post-webinar survey for a chance to win a $25 Amazon gift card. It is Prime Day also, so maybe you might be able to find a good deal. We will be hosting these solution spotlights on a monthly basis throughout the rest of the year. Next month, we are going to be spotlighting Smart Shopper, which is very exciting. We're still finalizing a few of those details, but I will put the registration link in the chat so that folks can go ahead and put that placeholder on their calendars. It'll be next month. And with that, I want to give another thanks to our presenters for joining us here today. I hope everyone has a great rest of their day, and we look forward to seeing you next month. Thank you all.